How do dementia symptoms vary by type? Imagine walking into a room and noticing that someone is showing signs of confusion, memory trouble, or personality changes. But did you know that these signs can look very different depending on the type of dementia involved? Understanding how symptoms vary helps doctors diagnose and treat each person more effectively. Alzheimer's disease is the most common form of dementia. It usually starts with memory problems, like forgetting recent conversations or important dates. Over time, people may struggle to find the right words, get lost in familiar places, or have trouble planning daily tasks. Mood swings and personality shifts are also common as the disease advances, and eventually, individuals might not recognize loved ones. The progression is gradual, often taking years to develop fully. Frontotemporal dementia, or FTD, tends to hit earlier than Alzheimer's, often in middle age. It mainly affects the front and side parts of the brain that control behavior and language. People with FTD might act impulsively, show emotional flatness, or have sudden mood swings. They might also have trouble speaking or understanding speech early on. Movement issues like shaky hands or balance problems can also appear, especially as the disease progresses. Lewy body dementia is known for its fluctuating mental state. Someone might be alert and aware one moment, then drowsy or confused the next. Visual hallucinations are common, and they may see things that aren't there. Physical symptoms often resemble Parkinson's disease, with slow movements, stiffness, and repeated falls. Sleep disturbances like insomnia or excessive daytime sleepiness are also typical. These symptoms can come and go, making diagnosis tricky. Vascular dementia results from problems with blood flow to the brain, often after strokes or mini-strokes. Symptoms can appear suddenly or gradually worsen over time. Memory loss might not be the first sign, but difficulty following instructions, poor judgment, and mood changes like depression are common. Physical signs include weakness or paralysis on one side of the body, and walking problems may develop. The pattern of symptoms often relates to where the blood flow was blocked. Huntington's disease is inherited and usually shows up between ages 30 and 50. It causes a mix of cognitive decline, involuntary movements, and personality changes. People may have trouble thinking clearly, experience jerky movements, and show emotional shifts. Memory issues tend to develop as the disease advances, and psychiatric symptoms like depression or irritability are common. Creutzfeldt-Jakob disease is a rare but very serious condition that progresses quickly. It causes rapid mental decline, confusion, and behavioral changes. Physical symptoms include coordination problems, involuntary movements, and sometimes blindness. Unlike other dementias, CJD can lead to coma within months, making early diagnosis crucial. Knowing these differences helps healthcare professionals make accurate diagnoses. For example, if someone shows early behavioral changes and language problems, frontotemporal dementia might be suspected. If visual hallucinations and fluctuating alertness are present, Lewy body dementia could be the cause. Recognizing the pattern of symptoms allows for better management and support tailored to each person's needs. Remember, each individual's experience can vary, and only a healthcare professional can provide a proper diagnosis. If you or a loved one notice changes in memory, behavior, or physical abilities, seeking medical advice is essential. Accurate diagnosis not only guides treatment but also helps plan for the future with the right support.